Back here. Greater Monte Nurses. Right here, right here.
Thank you everyone for coming on this cold morning.
We get more nurses. Greater Monte Nurses. Please come here. You said you needed someone handsome? Okay, come here.
These are my kids.
Here we have
Say
your
hi to
bargaining
me.
member, Samantha. Yeah, the more the better. The more the better.
Hey guys, come on, let me here behind. Bring it in, bring it in.
All right, thank you so much everyone for coming. I just wanted to say a little word, okay? My name's Samantha Alegria. These are my two youngest kids. This is Morgan and Ian. Ian, say hi guys. Hi. Okay, I've been a nurse here at Greater El Monte for 3 years. I'm on the bargaining team for the SEIU 121 RN at our hospital. Our message to Greater El Monte and AHMC management is to listen to your nurses. We are out here this morning for safe staffing. We are out here for our patients. Nurses are leaving this hospital and the result is unsafe staffing. Nurses are leaving and the solution is simple. Listen to your nurses at the bargaining table. We've had a lot of long-time experienced nurses leaving. We've also had a lot of new nurses leave. We have some people threatening to leave in the fall when they hit their 1-year mark. Because you're more desirable at other hospitals when you have at least 1 year of experience. So people are leaving and going where they'll be respected. There's more stability when you have nurses who have been working for a long period of time. Experienced nurses have the ability to think faster. Time is of the essence when you're talking about saving someone's life. New nurses are a great part of our team, and a whole community of nurses is great because our personalities all get along in this hospital. But you can't safely staff a hospital with just new nurses. They need experienced nurses as a resource, someone to look up to, and someone to ask questions to. We need consistency with staffing so our nurses are not overwhelmed and we don't have to get the emails asking us to pick up extra shifts. Those emails are coming often and nurses are going to get burnt out. Management says we know how to help our team to avoid working short-staffed, but we shouldn't have to burn ourselves out to be working short-staffed. Nurses are leaving. We hate to see our colleagues leave, but at the end of the day, people need to support their families. In bargaining, we have proposed retention bonuses to keep our valued experienced nurses and our new grad nurses. Other hospitals provide this. AHMC said no. We've proposed compensation that would help keep experienced nurses at the bedside here at Greater El Monte, and they've said no. We've tried to tell AHMC they need to invest in their nurses that they want to stay, so that our patients have the experience and stability. AHMC's attitude is they just don't appreciate us. Like listening to what nurses want just isn't a priority for them. Nurses are also leaving because of the stress of working in an unsafe environment. People bring weapons and nurses have to find them. We've had machetes brought in, razor blades, baseball bats. Some of these stay in the nurses' station for a long time. We've had patients punch our nurses. We've had patients threaten to pepper spray me. They've thrown sandals at me and others. It's rude. We have security. We try to have them help us, but we need more. We're here to save people, not put our own lives at risk. We want management to begin taking our safety seriously so I can come home to my kids. We want AHMC to follow OSHA standards for a safe workplace, but they keep rejecting our articles at the bargaining table. There are a lot of good reasons to protect nurses. One of them is that when nurses are unable to work at the bedside because they're sick or injured, that just makes our unsafe staffing problems worse. But management is unwilling to compromise when we propose to make our hospitals safer. They're not willing to work with us on whether we'll have protections in place for a future pandemic. They rejected our pandemic article. It's nerve-wracking to know that you may not be protected in the future if something were to happen. They're not willing to compromise, just like they're unwilling to compromise when it comes to attracting and retaining skilled nurses. They don't want to listen. So we're here to make them listen. AHMC, listen to your nurses before it's too late. Greater El Monte, listen to your nurses, otherwise they're going to be gone before you know it. Listen to your nurses, or we will continue to take action until we are heard. Thank you. So at this time, I want to introduce our Mayor of El Monte, Jessica Ancona.
Good morning, everyone. And first and foremost, I want to thank you for the important work that you do here at our hospital and in my community, caring for our patients, residents, oftentimes of the city of El Monte, South El Monte, our neighboring communities. You know, the last time I was here was March of 2021, during the pandemic, and we held an event honoring all of our hospital workers as healthcare heroes. And I was proud to be here and celebrate the hard work that you do. I want to share a personal story. During the pandemic, December of 2020, at the height of the pandemic, when we still didn't have vaccines, we're still figuring it out, I came down with COVID-19 and I was hospitalized for a week. This was at the time where your loved ones weren't able to come to the hospital with you. I essentially entered alone and was there for a week. I received medical care from the nurses. I received compassionate care from the nurses. When I couldn't have my family by my side, it was the hospital staff that tended to me, that helped me feel comfortable, that bathed me, washed my hair, helped me get up to use the restroom, to brush my teeth when I didn't have the strength to do it by myself. So I really do hail you heroes, because at the time when everybody was avoiding anyone with COVID-19, you were on the front lines caring for all of us, putting your lives at risk, putting your family's lives at risk with this unknown virus that was, plaguing our world. I understand the issues that you're facing here. Safe staffing, appropriate staffing is important, because back at the pandemic, you guys were stretched to your limits. You were working around the clock, helping us, and we need you to be healthy. We need you to be rested so that you can give proper care to our patients, so that you can be well. It is a fact that recruitment and retention deficiencies can lead to an unsafe situation for our patients. Many of the departments in the hospital have been understaffed, leading to a potentially unsafe situation for patients. Patients deserve to receive proper care in a hospital that rewards and respects experienced nurses. That is why we need AHMC management to address the hospital's high turnover rate. We all know that high turnover rates result in more temporary registry nurses, more instability, increased chance of sentinel events, which will have adverse outcomes for patients, and this is unacceptable. Nurses have the solution to recruitment and retention failures. It's very simple. Respect our nurses. Respect loyalty. Respect service and commitment to the hospitals that they work in. From shootings in hospitals in Tulsa and Atlanta to serious stabbing attacks in the LA area, violence against nurses and against hospital staff has become an epidemic. It needs to be addressed. Security guards do their best to keep our hospitals and patients safe, but they're not nurses. And our nurses are not security guards. Requiring our nurses to search patients and confiscate any weapons is ultimately inviting tragedy. We need our hospital to follow the Cal OSHA regulations, whether it be staffing minimums, providing protective equipment, so that when the next pandemic hits, not if, it will happen again someday. Nurses and patients will have the equipment necessary to keep them safe. I am demanding that AHMC listen to our nurses and stop rejecting their health and safety proposals. Until nurses receive compensation and acceptable working conditions that rise to the standard of the San Gabriel Valley and our surrounding communities, turnover is going to remain high. As frontline staff caring for our patients, our nurses deserve livable wages, appropriate working conditions, so that they can provide for their families and live with dignity. We need management to take immediate action and increase their recruitment and retention efforts of skilled registered nurses. Nurses and patients deserve a safe hospital. El Monte deserves a safe hospital. Thank you all for all that you do, for the important work that you do day in and day out. I want you to know that I am here in solidarity with you to fight for what you deserve. Thank you.
Thank you, Mayor Belmonte. Come on.
Thank you, Mayor Jessica. I appreciate that. Okay, I do want to say thank you again to everyone for coming out this morning and for helping picket and walk. I know it's so early and you're coming off of night shift and you guys are tired and you want to go home to your families and to your bed. I get it. I was night shift too, so thank you so much, okay? I do want to introduce one last person. If we can have Angel Harp, our Chief of Staff, please.
You know, it's interesting how folks in management talks about healthcare heroes and talks about nurse heroes, right? But there's a difference between saying it and actually treating nurses as healthcare heroes. And by doing that, nurses here at El Monte, we're not asking to get rich here. They're asking for the basic resources in order for they can provide the best patient care experience. And even for that we're asking, they still are not giving it. So we need to stand together because if we allow this to happen, nurses here, there's nurses in this community that they go to different hospitals and work, and they shouldn't be going over there. They should be working in their community hospital, and they should be paying them, and they should be protecting them, and they should be staffing you guys. So we're here, and we will be back. Every single one of you being here in this picket, this is just the beginning. This means that every single one of you are taking the first step of making change. And if we continue this fight, if we continue this fight, we'll win. But we all have to stand together and be united. Thank you very much, and thank you everyone for coming. And as we say, we'll be back. 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 We'll be back.
All right, thank you everyone. Let's finish it off with some picketing. If you're hungry, we have some sandwiches for you and we have waters. Thank you so much.
Thank you.